Hello, and thank you for joining us today. My name is Bessie O'Connor. I'm a registered dietitian and a project manager with Dairy Council of California. We're here with Dr. Sushma Chamarti, a pediatrician and obesity medicine physician, and also the chair of the California American Academy of Pediatrics, Chapter 1, Childhood Nutrition and Obesity Prevention Committee. Dr. Chamarti is here today to help us highlight the importance of milk in healthy dietary patterns as part of our National Milk Day celebration. Thank you so much for being here. I just have a few questions for you today. Starting off, why do you believe milk continues to be an important part of healthy eating patterns for children and families?
Hi, Bessie. Thank you so much for having me. To answer your question, milk remains an important part of healthy eating patterns because it's one of the most accessible, affordable, and nutrient-dense foods we can offer to children. For many families, especially in busy or resource-limited settings, milk provides a simple way to meet several key nutrient needs at once, like protein, calcium, potassium, and even vitamin D. It supports balanced eating without adding cost or complexity, and that makes it a practical, realistic option for families trying to build healthier habits.
That's great. So building on that foundation, let's talk more about how milk supports child's health. How do the nutrients in milk work together to support growth and development, including physical and cognitive development?
Milk is unique because of what we call dairy matrix, meaning it's not just isolated nutrients, but how all those nutrients work together in a whole food. The calcium in milk is highly bioavailable, meaning children absorb it efficiently, which helps build strong bones. The high-quality protein supports muscle development, especially in active kids. Milk also provides hydration, electrolytes, and micronutrients that support this immune system. And from a cognitive standpoint, nutrients like B vitamins, iodine, and high-quality proteins all play a role in supporting healthy brain development, along with social emotional growth and learning. It's one of the few foods that support multiple areas of childhood development simultaneously.
Wow, so there's so many factors that go into growth and development. But shifting from that individual health to kind of a more community perspective, I'd like to explore the role milk plays in health equity. So from your perspective as a pediatrician, what makes milk a food that supports health equity and accessibility for families?
That's a very good question. Milk is a strong example of a food that promotes nutrition security, meaning consistent, equitable access to nourishing, culturally relevant foods. It's affordable, available in every community, and flexible to meet diverse needs. Families can choose lactose-free options or various fat levels based on age and health goals, and culturally familiar ways to incorporate dairy in their food. Importantly, milk is also a foundational part of federal nutrition program like WIC, SNAP benefits, and also the National School Lunch Program, which reduces disparities and ensures all children from all backgrounds have access to essential nutrients.
So it's very, it's a way to kind of really meet the community where they are with practical nutrition option. So as we look ahead to National Milk Day, I'd love to close by focusing on a broader message for families. So what message would you share with families on National Milk Day about the role milk plays in lifelong health?
I would tell families that every stage of life builds the foundation for the next, and milk can be a simple, reliable way to support growth from early childhood all the way into adulthood. It fuels strong bones, muscles, and brains in childhood, and it continues to support things like healthy aging and mobility later in life. Small, consistent choices make a big difference, and including milk as part of balanced eating pattern is one of those meaningful choices that can positively impact lifelong health.
Well, thank you so much for sharing your insights with us today. We truly appreciate your partnership and the work you do to support children's health and helping us celebrate National Milk Day. Thank you.
Thank you for having me.